Right. Good morning. Good morning. This is Steve Belcher with Sunday Morning Transplant Coffee Talk. At the moment, we are having technical difficulties with our system. So I'm trying to get Jake on. We're having some problems behind the scene. What I'm going to do is switch to my Facebook Live page and see if I could connect with Jake from there. I could see Jake now. What I'm going to do. Jake, can you hear me?
Yes, sir.
Okay, so Jake. And see if I can connect with Jake. I'm having some issues. Okay. Now. This is live, y'all. This is live, and things happen behind the scene. But Jake, can you see me?
No, sir.
But you can hear me, right?
Yeah, I can hear you.
Okay, we're gonna start the show. I can actually see you and hear you on Facebook. I have my other camera, folks. I apologize for all the confusion that's been happening this morning. Again, it's Sunday morning. The devil is really busy trying to hinder us and getting this interview going on. So we finally got everything started. Jake, I can see you. I can see you here on my small phone, and we can see each other. Well, I can see you. You probably can't see me, but everything is a go. So Jake,
Okay.
welcome to Sunday Morning Transplant Coffee Talk. I appreciate you joining us this morning. How's everything going?
It's going all right. Just a normal Sunday.
Absolutely. Before I get started, I wanted to share a story that I just heard yesterday from one of my former coworkers. A gentleman just started dialysis 6 months ago, and he was talking about getting on the transplant list. So he finally made a decision to go to one of the hospitals in Baltimore to get on the transplant list, and they turned him down. So the technician referred him to another hospital in Washington, D.C., and he had to collect some blood. They were missing some, so they finally got one last tube, and the gentleman got a kidney, a double transplant, kidney pancreas transplant just this past Wednesday, and been on dialysis like less than 6 months. So I just thought that was amazing, because unfortunately that doesn't happen, with a lot of people. That's just one of many stories that people need to hear to still keep their hope that it is possible. But Jake, tell us about yourself, man.
Well, it's funny that you kind of started the story off like that, because that's kind of how my story initially started. In all honesty, when I
Okay.
was 12 years old is when I was first diagnosed with kidney failure, end stage, and I'm now 36. When I was first diagnosed at 12 years old, it was kind of a fluke accident. They found it because they had put me on Ritalin, and they were just doing some routine blood work, and they were doing.
Uh-oh, look like we lost Jake. Hope he can get back on. Wow, that was an interruption. So hopefully Jake would come back on. But as I was sharing, um, gentleman here in Baltimore, Maryland, don't know his name, but he recently started dialysis less than 6 months ago. And the story goes, he was talking about transplant, was talking to the technician. She was encouraging him to get on the list. He wasn't sure if he wanted to get on the list or not. So finally, the gentleman got on he went to one of the hospitals and he went through the process, but he was denied to get on the list. So the gentleman obviously was frustrated and disappointed. So his technician kept encouraging him to try another facility outside of DC. I'm sorry, outside of Baltimore. So I believe the gentleman went to DC. Okay, we got Jake back. So I'll finish that story. Jake, you back? Can you hear me? Oh my God, he disappeared again. Not sure what's happening with this show. The devil is busy, but that's okay. We're going to keep this show going. As soon as Jake reappears, we're going to get him back. So as I was mentioning, the gentleman tried another hospital outside of Baltimore and believe it was in Washington, D.C. So they needed to get blood work from him. So they drew blood work, and apparently one tube was forgotten. So they ended up drawing the last tube and sent it to the transplant center. And behold, the gentleman was called on Wednesday for a transplant. Transplant, kidney, pancreas transplant. Hey, Jake, we got you back.
Yes, sir. I'm here.
Okay, great.
Yeah, I'm here. I saw that you shared that thing on the Facebook Live, so I went to it thinking maybe I could just join you through that, and I lost everything. But I'm back.
Don't worry about it. But this go back to sharing your story. You was diagnosed at 12 years old with kidney disease.
Yes, sir. 12 years old. I was diagnosed, and because they, like I said, it was kind of a fluke thing. They put me on some Ritalin, and after 3 months, they did some routine blood work for me, and they said everything was normal except my BUN and creatinine was off. So they went in and they did some more testing and found out that at that time I only had 13% or 15%, something like that, kidney function.
Wow, 15%.
Yeah. They said it basically has probably been going on since birth, and I just had no symptoms because with kidney failure, there's not always a symptom.
But what about the blood work? I mean, the kidney function test.
They just, like I said, they just did it because of the Ritalin can cause issues with your liver.
Got you.
And so they just did a whole panel, a complete blood panel, and the kidney numbers are the ones that came back bad. My liver was fine, but the kidney numbers came back as irregular. So then they went and did a sonogram of my kidneys and found out that one of my kidneys had atrophied to about the size of a walnut, he said, and the other one had grown to take over the work that the first one wasn't doing, and then it had started to atrophy also. Wow. So they told me, it's not to a point where we need to put you on dialysis or anything. They gave me a slew of medications, and they said they changed my diet to the low sodium, basically the dialysis diet, and started me on the workup for the transplant list. Okay. So they did all that, and this was all in Albuquerque, New Mexico. So they did all of that, and I got put on the list, and that took I think it was about 6 months worth of tests and going back and forth and all that. Everybody knows about that part. And so after I got put on the list, I guess when I first found out, it was right before I turned 13. So then they did all the testing, and that took a few months worth of testing. And then, once you get done testing, then it takes a few months to actually get listed. Well, we got the letter and the confirmation that I'd gotten listed in like February or March when I was somewhere about that time when I was 13. Or our ages still escape me. It's somewhere in that vicinity. Anyways, literally, I found out that I was my blood type's B negative, which is kind of one of the more rare blood types. And before I even went on the list workup, everybody in my family got tested, and they were all A blood type. So nobody in my family could directly be a live donor. So once I got on the list, it literally took less than 4 months, and the doctors called me and said, "We have a kidney for you if you want to come to Albuquerque." And we lived in a small town called Portales, and it was a 4-hour drive. So I can still remember it was like 10 o'clock at night. My mom woke me up, and we drove to Albuquerque that night. We got to Albuquerque about 2 in the morning, 3 in the morning. We went straight to the hospital. They did all the blood work, came back. Now, as if everybody knows or who doesn't know, there's the 7 antigens that have to match to judge whether it's a good donor or not. Well, they told me that for some reason this kidney only had 6, and my antigens matched 5 out of 6. They said that there's no more perfect of a match. That's almost like getting a perfect 7 for 7, which never happens. So they said, okay, so here's your decision. They said, right now you're still at 13% kidney function. You don't necessarily need a transplant at this moment. You're still, he said it could go 6 years working on this medication and diet, or it could go 6 days and it could drop to less. He goes, there's no way of telling exactly how long it's going to work like this. He said, so you can take this transplant today, or you can wait and wait for the next one. But because of your blood type, it could be anywhere up to 10 years. But it could be less because of your age. But he said there's no guarantees and there's no way of telling what could happen. And so, he left the room and yes, sir.
I'm sorry, you was 13 years old when they came to you with this information?
Yes, sir. Yep.
Did you discuss this with your parents? Was this like a family meeting, or you had the final say so of this?
Well, in the hospital that night, it was just me and my mom. And so after the blood work, actually, I forgot they sent us. We went to a hotel and came back at 7 in the morning. And so we were just sitting there, and they told us all this information, and they left the room. My mom was like, she told me, she said, well, she goes, this is your life. This is going to affect you for the rest of your life. She goes, I personally want you to take this transplant, but she gave me basically the final say so. That's kind of how my mom's always been. And so literally at 13 years old, at 7 o'clock in the morning, after barely sleeping, I had to make a decision. Did I want to take a risk of not getting another transplant, possibly getting put on dialysis eventually, and blah, 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 blah? Or did I want to just go ahead and take this transplant and thoroughly change my life from there on out? And so I thought about it for a second, and it's kind of funny when you're 13 and 14, kind of what your focuses are. And like it's kind of funny because the main thing I was a kind of leaning against it was I love to play sports, and one of my favorite sports to play was football. And I knew exactly, and I was, I'm not going to try to be Al Bundy or anything, but I was pretty good at sports, and I was very good at football. And so I was just kind of like, that's the only thing that was my hang up. But I eventually within about an hour or 30 minutes, I decided to go ahead and go with that transplant. So at 14 or at 13, I got my transplant, 14, whatever, that night. So that was at like 7 in the morning. By the time I got on the operating table, it was probably 6 o'clock in the evening. And by 2 in the morning, now back then it took them 12 hours to do the surgery.
Wow.
I say back then, that was back in like 97, 98, something like that. 96 maybe. And so I was on the operating table for 12 hours, that are 9 hours or some crazy lengthy surgery like that. And I woke up and it was working immediately. There was no downtime. As he said, as soon as he hooked it up, it started producing urine immediately. And so everything went to start working within seconds of being connected. And everything was great. You know, I stayed in Albuquerque for the amount of time I think I was there for. I was in the hospital for like 2 weeks, and then I got out. I had the transplant April 19th, 1996, and then I remember I made a deal with the doctor that I wanted to be home by my birthday, which is May 7th. So I think I got out of the hospital the day before my birthday, or right around my birthday, right before it. And so I got out, and from the age of 14 on, everything was copacetic because my mom was around. My mom was the one who she always made sure I took my medication, even when I didn't want to, because you know that stuff not only makes you feel like crap, but also tastes like crap. But you know, I took out, you know, for 4 years, basically every day on time. I took my medication. I went to my doctor's appointments. I was praised, highly praised, because my creatinine was like 0.2, 0.3, and zero point 0.4. You know, my creatinines were always perfect or better than perfect. You know, all the doctors, all the nephrologists, all the transplant coordinators, you know, all were shocked at how good my blood work was. You know, they said that most transplanted kidneys run about a 1, or right around the 1 area for creatinine, and they were saying, that's really low for you. That's really good. That means it's working excellent. And everything was good. Well, when I turned 18, and as most 18-year-old people do, I moved out of my family's house, and I went on a 18-year-old journey and started doing things that I shouldn't have done, and stopped taking my transplant medication, and I still went to my blood work a few times after that, because by that time, it had been 4 years, so I was down to once every 6 months or something like that. So I still went a couple times, or at least one more time. And after not taking my transplant meds for 6 or 8 months before I went, and they were like, okay, everything's good, your creatinine's 0.6. They're like, everything seems to be working great. You're taking your medications. And of course I lied. I was, again, 18 years old. I was like, yeah, everything's going great. And they were like, all right, well, have a great day. And I left and went on with my life, and went through some negative stuff, and ended up leaving. At that time, I lived in Phoenix, because when I was in high school, my parents and I moved to Phoenix. Well, when I turned 19 or almost 20, I kind of went through, like I said, some bad stuff, and I ended up going back to Portales, where I had lived for most of my childhood. And when I got back, I got a job and went 3 months, got insurance, and I went and got my kidney checked. I went and got the blood work done, and got a call and got my doctor's appointment set. And like I said, I'd probably been in Portales like 6 months by then. And I remember walking into the doctor's office, and the doctor was like, he goes, "You're Jacob?" And I said, "Yes, sir." And he goes, "Jacob King?" And I said, "Yeah." And he goes, "I don't understand how you're walking." And I go, "What do you mean?" He goes, "Well, your creatinine is through the roof. Your phosphorus is outrageous. Your BUN is sky high." He goes, "Your potassium is high." He goes, he said, "Most people with numbers like yours would be bedridden in a hospital." And I didn't believe him. I was like, "Well, I don't feel bad at all. The only symptom I had was itchy skin from the high phosphorus."
Mm-hmm.
And so he said, "Well, I'm sorry, but I have to put you on dialysis tonight." And that was February of 2001. He was like, "I have to put you on dialysis tonight. Because your body, I'll be surprised if you make it another day, much less longer than that."
Wow.
And so, yeah, so they put me in an ambulance in February on a 4-hour drive back to Albuquerque, which was, at the time, it was University of New Mexico Medical Center. And even the nurses and everybody in the, while I was waiting for the ambulance, were saying, you got to act sick or you're going to get charged for this ambulance ride. Like they were trying to help me, you know. They were like, your insurance is not going to cover it if you're not sick. And I was like, but I don't feel sick. I was like, I feel fine. I don't feel any type of sickness at all. So the ambulance came and got me. It was normally a 4-hour drive. It took like 6 hours because about an hour outside of Albuquerque, we hit snow. I got to Albuquerque that night. They rushed me into surgery. They put a groin catheter in, and they dialyzed me that night. The next day, they put my fistula in and started dialysis on my groin catheter, or put my fistula in and then put the permacath in my chest. And I started dialysis right then and there. And that was in February of 2001 when I was 19 years, almost 20 years old.
Wow. They put a fistula in the next day. I mean, didn't give you any opportunity to decide what arm or do a vein mapping or anything like that. They just said, we're going to put a fistula in your arm.
Pretty much, yeah. I guess they did the vein. They did all that while I was on the operating table. All they asked me was what was my strong arm, and I said I'm right-handed. And so they went to my left arm, and I guess while I was out, they did the mapping and found which vein to use and hooked it up. It was a left upper arm fistula. So
Jay, let me ask you. So at 18, said you weren't taking your medication, and by me working in dialysis, I've seen this a lot. But the reason you didn't take it, was it that you couldn't afford the medication, or did you have the medication and you just didn't take it because it was a lot of pills?
It wasn't because I couldn't afford it, because I could have easily went to my mom or my grand. I had a lot of family members that if it came down to affording my medication, I could have got it. It was, and it really didn't. And it took. I don't know how people feel about therapists, but it took a lot of time talking to a therapist to just kind of realize that and it makes a lot of sense. And I kind of feel like this might have been part of it, but I was told by a therapist that a lot of adults and young adults that are diagnosed with a life-changing ailment, the medication was the only thing I could control. So it was my way of being in control of something in my life. It was my way of just saying, I don't have to do what I don't want to do, and I'm going to do these other type things and not. I was a drug addict, and so I was doing these other things, and because I was just like, I'm not going to take this medication anymore.
Right. And you know what, dude? There's definitely nothing wrong with seeing a therapist. I seen a therapist, and I think everyone should who deals with any type of adverse situations or a chronic illness or just the stress of daily life. So I can completely understand that. But the good thing is that you're aware of that now, and that's great, man. And we have a show, Urban Reno Talk, with Tamika and Steve, that we talked about that even now we think that there should be some type of licensed therapist inside a renal treatment facility just for people, because no one can't possibly understand what someone else is going through, unless you're doing it your own self. But just for someone to express or just to, talk with I think would make a huge difference.
Oh, no doubt. I agree. I mean, in the 17 years that I've been on dialysis, not right in the beginning, because in the beginning, I was still learning and stuff, but I'd say in the past 8-9 years, I've made it a point to tell my dialysis clinic managers, if there's any patient that feels like they need to talk to somebody who knows what they're going through, that's new, that's, a new patient, or not, I was like, you can refer them to me, because I've always been about helping other people. Like, it's just, I've always been that type of person. And just not to give too much detail, but there's a person in my dialysis clinic that they were having some major issues when they've only been on dialysis a short period of time, and they were wanting to quit, and I just, stuff like that. Like, I like to talk to people like that, and kind of, and I do it on all these support groups on Facebook too. If I see somebody making posts about not feeling any sort of good way, I always reach out, and if they come back to me, I try to become that person. Because I remember when I first started dialysis, if it wouldn't have been for I had this one older gentleman, probably in his 60s, and like I said, I was 19 years old. Most 19-year-olds, we're not going to listen to some quote unquote old man, but at that time, he was one of the only reasons that kept me going back to dialysis. And not saying that my family wasn't huge supporters, because they have and always will be, but when you're in a dialysis unit, it's you. That's it. You're by yourself. You become friends with the techs. You become friends with the nurses. But like, that's it. That's what they are. They're nurses and techs, and they understand on their end what it's like. But nobody understands what a dialysis patient physically goes through except another dialysis patient. And so this guy, and then there was this other gentleman who was maybe a few years older than me. He was probably as old as I am now. He's probably in his 30s. And me and him became really close and really tight. And like, to build those bonds, it taught me that is, especially as a new dialysis patient, that is by far the best form of venting, I guess, for lack of better terms, that you can do. Because you can have a nurse or a doctor or a dialysis tech tell you all day what's going to happen and what might happen and stuff like that, but until you sit next to somebody and they say, well, no, you're fine, I went through that, everything's good, or no, you know what, that's not a good thing, might want to ask the doctor about that. Like, just to kind of have that in my first few years in dialysis made things, I mean, it made things copacetic. It never was fun or doable, but it was just, it made things seem okay to go for 19 years old to be 3 days a week hooked up to a machine.
Right. Hey,
And
hey
and
Jay.
so, yes, sir.
No, go ahead. I'm sorry. Go ahead.
All I was going to say is, and so, the whole licensed therapist in a clinic, that would be, I had therapy for a year, and it made a huge difference in my mindset at that time. Because by that time, I'd been on dialysis like 10 years or 11 years or 12 years. And I was kind of hitting that slump of depression, and that therapist really helped me work through some things. And I came out of that 1 year of therapy like a different person again.
Wow. Wow. Hey, Jay, did you, when your transplant rejected at 18, 19, did you beat yourself up about that?
Not at first. Um, it took about a year or so of being on dialysis. It kind of started to, because first of all, when I started dialysis, they told me, because I was non-compliant with my medications, that I had to be compliant on dialysis for 6 months before they would ever consider putting me back on the transplant list.
Okay.
And then after 6 months of being non-compliant on dialysis, skipping treatments, signing off early, just non-compliance, I had a doctor who I really didn't like, but he saved my life, to be real about it, to be 100% real, because I went to a small town clinic, and it was the only clinic within 45 miles of where I lived, or an hour or more, maybe even 60 miles. And he came to me and he was like, look, man, you're missing treatments. You're signing off early all the time. He goes, there's people waiting in line to come to this clinic that go an hour, hour and a half every day to for every dialysis day for their treatment. Because if you don't stop missing and stop signing off early, he said, I'm going to basically, he was going to kick me out of that clinic and make me go to one of the further ones away. And so I just, from that point on, and I didn't get a chance to do my workup because I wasn't compliant. So from that point forward, literally in the next 17 years, I haven't missed a treatment unless I had a doctor's appointment, and I don't sign off unless it's extremely, extremely important. And even then, I won't sign off more than 30 minutes early because, I didn't realize that it was a gift, and I kicked my own butt for a while thinking that my life was so different because I was so lazy and so stubborn that all I would have had to do was take my pills right and everything would be copacetic.
Mm-hmm.
But instead I wanted to fight the system and put it to the man who was making me take all these pills, and I was going to do me no matter what. And so in a roundabout, straightforward type way, me being on dialysis was my fault. It was nobody else's fault but my own. But I had to own up to that. You know what I'm saying? So I went from beating myself up to owning up to it. Like, I did this to me. Nobody else took the pills out of my hands. Nobody else, said, nobody else was in my ear. It was all me.
Mm-hmm.
And
Mm-hmm.
so there's part of me that was beating me up. But then then after a few years went by, to a point where now I feel like, it wasn't God's plan for my kidney to fail, but because of what happened, I met my ex-wife because I came back to Portales because of the kidney failure and how I was feeling, and I met my son's mom. I had a child, which all doctors told me that I wouldn't be able to because I'd been on dialysis. By the time I met his mom, I was 6 years into dialysis, and they said there's a very small chance. So yes, I did it to myself, but at the same time, I feel like if I would have done something different, there's no way of saying for sure, but I don't know if things would have turned out the same. So
Right.
I was upset at myself, but at the same time, I don't think I would change it. You know what I'm saying?
Right. Right. So are you now back on the transplant list?
I was, and then because I weighed I was at about 140 pounds. I'm 5'6", 5'5", and I was on the transplant list. Well, when I went through this depression period, I ate and ate and ate, and I got up to about 280 pounds.
Okay.
They took me off the transplant list because my BMI was way too high.
Okay.
And about 2 years ago, I started this thing, and I was like, I was super overweight. I was very uncomfortable. I had, it was a horrible feeling. And I went and I just decided, and I started kind of doing some research, and oddly enough, sitting in dialysis, listening to my phone to a podcast out of Phoenix, Arizona, called John Jay and Rich. I was listening to this radio show, and this guy's super fanatic about diets, and he just posted this question on his radio show of anybody who has tried weird diets that have worked. And some guy came on and was talking about this IF diet. It's called intermediate fasting. And he said he lost like 60 pounds and blah, 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 blah. And I'm not good at not eating things that I like, but I decided I was going to try this intermediate fasting, which basically means you eat for 8 hours during your day and you fast for 16 hours on a regimen. And so I started that diet 2 years ago in like November. So in this November, it'll be 3 years. And within a year, I lost 40 pounds. The next year, I lost 20 more pounds. Right now, I'm at a total of about between 50 and 60 pounds that I lost. I'm
Congratulations.
about, yes, sir, and thank you. I'm about, I'd say about 15 pounds from the 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 BMI level that I have to be at to get back on the transplant list. My dietitian and I did the math, and I think I have to be at 99 kilos and for my height, and I'm at 104 kilos, so it's more like 10 pounds. So 4 pounds or 4 kilos, 4.5 kilos I got to lose, and I'll be ready to get back on the transplant list and get me a transplant.
Oh, absolutely, man. Absolutely. Um,
Yeah.
wow. Let me just ask you, are there a lot of dialysis facilities in New Mexico?
As far as I know, I mean, in Albuquerque, which is in Santa Fe, which is the capital, and it's the biggest city in New Mexico. I'm sure there is, but the two cities that I've lived in New Mexico, like I said, I lived in Portales for a total of like 15 years of my life, and I've lived in a town called Alamogordo right now for the last 4 years, and there were in my town in Alamogordo now. There's a clinic in my town. It's a Fresenius clinic, and then the nearest clinic from here is an hour and a half west, or an hour and 15 minutes west of here in Las Cruces, or an hour and a half south in El Paso, Texas. So New Mexico is a very rural type state, so there's a lot of small rural towns. So as far as I know, there's probably, when it comes to the amount of dialysis clinics, it's probably few and far between. When I lived in Tucson now, I lived in Tucson for 5 years before I moved back to Alamogordo, because I was with my mom, living with my mom, and living near my mom and my little sisters. Um, there was clinics all over Tucson. Like I had like 5 clinics within a 20-minute drive of me, if not more. And so, um, when it comes to New Mexico, from my experience, the clinics are very sparsely set up, like where they're at, or it's very, very sporadic.
Hmm. So let me ask you, Jake, at when you had your transplant at
Uh-huh.
14, 13,
Yeah.
you were taking your medicine faithfully in the beginning.
Yeah. For the most part. Yeah.
Okay, because I'm sure you was living with your parents at 14, 15, so they made sure you took it. And,
Yeah.
and so at
My mom was very regimented about it.
right, and so at what point at 18, or do you remember when you just said, I'm just not going to take it, or was it the decision that you was like, I'm not going to take it, or you just started doing other things and you forgot about the medication?
It was a combination of both, really. I mean, it kind of was like, because of the other things that I'm doing, because of the other illicit stuff that I'm doing, I'm not going to take these other medications anymore. Because not only do they slow me down, but they don't, I don't feel any different. So I don't feel like they're doing anything. I think I could do fine without them type situation.
Mm-hmm. Wow.
So yeah, so it was just kind of like I said, it was a combination of um, what I was doing that wasn't right, and the fact that if I just didn't feel like taking those pills anymore. Because for everybody who's been a transplant recipient, you're taking pills that make you feel sick that are supposed to help you, and then you're taking pills to counteract the side effects of the pills that are supposed to help you, and then you're taking pills to counteract the side effects of the pills that you know what I'm saying? So it was like this, you're taking 30 pills in the morning, and it just got to be where I was just so, I mean, it almost happened immediately. It was like I moved out, and within a couple of days of moving out, I stopped taking my medication. I got, there was some of those medications, you take prednisone, and I remember I took the FK 50 whatever, and I took you take all these pills that would upset my stomach, and I hated feeling like that. And it just got, like I said, within a week or so, I just got to where I was like, you know what, I'm not going to take these anymore.
So
It's
since
harshing my mellow.
right, since then the medications have changed, right?
Yeah, as far as I know, I hear a lot of people taking things that I can even remember when I was first started, them talking about that they were in trials, and now I see people taking them all the time. But yeah, the medications have definitely changed, um, which is a positive because maybe they found a better combination and they can give it to people that doesn't affect them as bad in the body way.
Right, right,
Plus, they've come up with so many soon to be options for kidney transplant where medications will be even less necessary. I know that it's all futuristic and it's all in the future anyways, but like the bionic kidney that they're talking about that created at University of California, San Francisco, and the doctors that put that together, that's in the near future to maybe not quite near future, but at least in my lifetime, is possible. And then the the organs that they've found that they can wash out and basically leave the scaffold clear protein and then fill it with your own DNA cells and then incubate it, and it grows into basically your own kidney and
right.
heart. And all this stuff that they're working on in this day and age medically, you know it's it when it comes to transplants and medication, you know people who have kids, young kids, teenage or younger, in their lifetime, they may not have to worry about immunosuppressants and all those horribly just gross pills, I guess, for lack of a better term. You know what I'm saying?
Yes, Jake, I had a question from someone. They wanted to know from Joe Bueno. He wanted to know why you were taking so many pills when you had
Well,
your
as,
transplant.
well, as far as I knew, that was par for the course back then. You took I can't remember them all, but I know I took two or three of certain pills. I took prednisone and for the immunosuppressancy and the anti-rejection pills. You took a couple of those, and you take stomach medications because some of the pills can cause stomach issues. You take calcium pills to supplements to help keep your calcium up, and all of them can be weaned down slowly, but none of them do you ever completely. Well, of course, I'm no doctor, but in my experience, I didn't come off of any of them. I just got weaned down to, if I remember correctly, when I first got out of my transplant surgery, I was taking a very large dose of steroids of the prednisone. And by the time I left, within a year or so, I was down to just like a 20 milligram pill. So there's, you have to take each of these pills 3 times a day. The morning was the worst. The morning you had to take the biggest handful of pills. Maybe 30 is a bit of an exaggeration. Maybe it was closer to 15, 20 pills. But I remember it filled up the small part of my hand. And I got to where I would just take them all at once because, that was just a long process to try to take them one at a time.
Mm-hmm.
But as far as I know, that many pills, maybe, like I said, I may be over exaggerating to some extent because I was a kid. But I remember it was a good 15 to 25 pills every morning. And then noon and night, you take about 8 or 10 pills also.
Right,
Some of them the same from the morning, and some of them a couple extra different ones that would help through the nighttime.
Jake. Are you still using the same fistula that you got at 19?
No, the fistula I got at 19 worked for about 11 years, 10 years. About, or even maybe a little longer. No, it was about 9 years it worked. And then it it clotted off, and like I said, a few years back, and they basically what they did is once it clotted off, they put a graft in that same left arm. They put the little U graft in my left arm, basically right around the fistula. And then, of course, they put a catheter in for a short period of time while that graft matured, or not so much matured, but healed. And then after that, then they started using the graft. And I don't, I'm no medical professional, but if I can steer away from grafts, I don't. That thing only lasted 4 years, and I'm very meticulous when it comes to laying on my arm, or I'm very, very meticulous about that. I don't put any negative pressure on my arm. So the graft itself only lasting like 3 or 4 years was just, I didn't understand that, but it only lasted 3 or 4 years. But the positive side of it was at that time I was in Tucson, and I had an amazing. If half the patients in this country, shoot, across the world, could have a doctor like I had in Tucson, her name was Dr. Sussman. That doctor she worked with you. She was amazing. She knew what she was doing. And I'm not saying other doctors don't know what they're doing, but like she just had a very strong confidence that made you as a patient feel confident.
Mm-hmm.
And so she, about a year before my graft finally gave in, she just told me, she was like, look, your graft has been giving us trouble lately. And so to save you from having another permacath, she said, let's go ahead and schedule your fistula surgery, mapping and surgery, and let's get you set up for a fistula. So by the time your graft fails, you already have another access. And it took some convincing because, as a medical patient for as long as I have been, and I'm sure others can relate, you avoid the doctor as much as possible.
Right.
So it took
right.
so it took some convincing. Damn it, this light behind me is killing me. Hold on. Sorry. Okay. So it took some convincing, but I eventually, I did what she said after, talking to my mom, and my mom making sure that, convincing me that that's what I needed and whatnot. And so I went in and I had the mapping done, and a couple months later they scheduled the fistula, and they put the fistula in my right arm. And for about another 6 to 8 months, if not maybe a year, the graft kept working and we just kept using it. And I kept strengthening my fistula. And then one day my graft failed, and they tried to declot it, and it worked for about an hour or two, but then it clotted again. And so they were like, all right, well, this graft is done. Let's go ahead and start using your fistula. So thank God I didn't have to go through another catheter, fistula surgery, wait, blah, blah, blah. Like the fistula was good. It had been in my arm for about a year. So it was ready to go straight on. And so I've had this fistula in my right arm now for maybe 4 years, maybe a little longer. And I've only had to have a declot once, and I've went a couple of times for the maintenance where it's not actually clotted, but they go in there and they do the
kind of clean it
fistulogram
out.
and
Fistulogram.
Yes, sir. Hold on, I gotta stand up.
So,
gosh.
So Jake,
go ahead.
So right now you have 3 accesses.
Yeah, pretty much.
Wow.
I mean, two of them had accesses, but yeah. So blood pressures are quite the experience because, they can't put it on anywhere but my leg because of the dead access in my left arm. They can't put it on my upper left arm, and they can put it on my wrist, but because of the lack of blood flow, it doesn't always get a good pressure. So they always go to my leg, and because that's further away from my heart, sometimes they come up low, and my techs and nurses all want to turn me down and turn me off, and it's a constant struggle, but it's better than the alternative.
Correct. So what's for the future? Do you plan? Do you have any goals as far as time frame on getting back on the transplant list?
Well, to be honest, it's hard for me to set that kind of stuff because I don't like to set myself up for disappointment. Um, my goal is to just keep working towards it and to get on the transplant list. So that's where that goal lies. It's not really a time frame as much as it's just it's got to be done. Because like I said, I got a 13-year-old son, and I gotta, I can't, I gotta be healthy for my little boy. So that's key. And what I do now is healthy to an extent, but mostly it's just getting by until I get a transplant. There's still the normal fears that everybody has, and because see, about 12 years ago or so, right after he was born, I was on the transplant list, and I got called twice to go for a kidney transplant, and both times I said no. Now, some people may think that's crazy. Some people on dialysis or some people, in my same situation think, why would you say no to a transplant? And to be honest, it was just something I felt wasn't right at the time. And maybe I should have taken them, maybe I shouldn't have. But one of them had to do with the fact that it was in Baltimore and nobody in that region matched. And so, once UNOS does regional, they go international, and I just happened to be the next one on the list. And so when they called me and told me the whole situation, I was like, by the time I got on the operating room table, if it matched, would have been over 24 hours outside of the body. And like, because like at that time, it was a 4-hour drive to the hospital and blah, 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 blah. So, whether it was right or wrong, I told them, give that kidney to somebody that's closer by that it has more of a chance working for, because I would hate to go through all this only to have the kidney not work because of how long it's been out of the body. And I said no. And so they went on to the next one. And so, I've had the opportunity a couple times, and part of me also thinks that I wasn't mentally prepared. I just had my son's mom had just given birth to him, and he was 6 months old to a year. And I was like, I can't leave my family for 3 to 6 months with no income, with no, it was a whole big picture thing. And it was kind of upsetting to certain people in my circle, but it was what I felt was best at that time. And so, like I say, to long story short, is my goal is to get on the transplant list as a time frame, in the next year or so. But it's not anything that I'm setting a harsh goal on myself, just because if I don't get there, that's just setting myself up for disappointment. So as long as I get there, that's success enough. You know what I'm saying?
Okay. Hey, Jay, we had a question. I know you went over this about your fasting, but we had a question from someone who wanted to know: do you work out and diet?
No, actually, just diet. That's all. I don't. And when I say diet, it doesn't mean I eat salad and drink milk or drink, smoothies made of kale and apple juice. Like all I all I do when it comes to being to a diet is I eat less. I still eat the stuff that I probably shouldn't eat. I still eat, no judgment, but I still eat like pizza, and I still eat hamburgers, and I still eat, you know, uh, sweets here and there. But I just do it less than I used to, because when I was at 280 pounds, I could sit down and eat a whole large pizza, no problem. Now, if I eat more than 2 pieces, I get full, because I just started slowly cutting back. And when you fast, you automatically, your stomach's going to get smaller because you're putting less food in it. So I found that after fasting for a few months, even if my eyes were bigger than my stomach and I got a big amount of food, I couldn't finish it.
Mm.
So it got to where I just basically now if I go out to eat, I don't get anywhere near the amount of food I used to get. I still eat bread, I'm sure I can make little tweaks here and there, cut out bread, cut out blah, 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 blah. But at the same time, I've always, I like to eat the things I like. And as long as I eat them in moderation, there's nothing, as long as I don't sit down and eat 4 pieces of chocolate cake and I eat 1 piece and I make it even smaller than a piece, that's just kind of how I do things is I don't eat anywhere near the amount of food in one sitting as I used to.
Mm. So Jay, when you got your transplant at 14, during those years, which pretty much was your adolescent years, uh, the kids treat you different, or did any of your friends knew you were sick or treated you a different way because uh, you had a kidney transplant? I know you mentioned
You know,
sports and everything like that.
yeah. Well, the blessing was as I lived in a small town. Like I said, it's called Portales. There's probably a population of 12,000 people total. And everybody knew everybody. The funniest thing is most people didn't know what was wrong with me. People thought my liver had failed. People thought I had a lung. I mean, how many different stories I got when I came back from my transplant was just ridiculous. I got my transplant the end of my freshman year. When I came back to school my sophomore year, the stories that had ran through my little tiny school was just funny. And I was never I never fell into that whole high school like clique thing where you had the jocks, the blah 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 blah, and I was friends with everybody. I'm a very friendly, very outgoing person, and I was friends. I didn't care what your high school status was. I was your friend. If you were my friend, we were friends, and I got along with almost everybody. And so when it came to being treated different, nobody really treated me different. Everybody just kind of accepted it. And like I said, a few people thought weird things like I had my liver went out and I needed a liver transplant, and people thought my lungs had failed. Some people thought I had cancer. So I mean, I tell you the
All kind of
weirdest
stories.
stories. Yeah, but yeah, as far as being treated different, I had such a large friend group that there was nobody that really tried to treat me differently. No,
Right.
thank God.
So, and the reason why I asked that because now kidney disease has exploded. Um, I'm sure from the time when you first started at uh, 13 being diagnosed to now, I mean, it's a lot of people on dialysis. So
Yeah,
for that person who may be 13, 14, who may be watching, or a parent of a child that's 13, 14, 15, that may be just hit with a chronic illness such as kidney
yeah,
disease or
yeah.
anything such as that. Any advice, since you went through it at that early age, that you could fast forward and get someone dealing with it in this day and age?
Two things I could say is number one, as a kid, from the kid's perspective, from the patient themselves at 13 or 14 years old, or going into high school age type stuff, is you're only as sick as you act.
Mm.
So like if you go into school and you are constantly using your sickness and people are going to treat you differently. They're going to coddle you, and they're going to always try to they're going to treat you differently depending on how you carry yourself. When I went to school, nothing changed in me. The only thing different was I had a kidney. Other than and that's a big change for me. But as my friends group, nothing changed. I was still outgoing. I was still energetic. I was still I did me. There was no change in who I was as a person. I just did it, and it happened over the summer. I got right. I did what I needed to do, and I moved on. Nothing changed. I was still the same Jacob that went to the hospital in April to get my transplant as I was when I came back in August for my sophomore year. I just couldn't play football anymore. That was the only difference, you know. And as a parent, all I could say about that is my mom has been and still is to this day always been a rock. Like she never let me see her sweat when I was a kid. She never let me catch her slipping. Like she was always on the ball when it came to having, because I can only imagine having my child diagnosed with a life-changing situation and how hard it would be. And so my mom was always like right there. Like she never, and to this day, if I have to go to the hospital for something, she lives in Tucson. It's 5 hours away from me. She's driven from Tucson to where I'm at to take me to my doctor's appointment.
Wow.
Like, so as a parent, advice to a parent is not to treat your kid like he's sick or she's sick. Just be there, either physically, emotionally, any time your kid needs something. It doesn't mean coddle them. It doesn't mean, rock them like a baby. It just means just be there, like, and you don't have to say it, but just be there to the point where they know if stuff gets rough and something escalates that I got my mom and my dad, or my mom. In my case, it was mostly just my mom. I got my mom on my side, and and that's all you can do. And not everybody's like me, and but that's all it took for me, was just to know that when I got sick or I needed my mom, there was no judgment of because from 18 to 20, when I was going through all my bad times, like my mom was still there, and she would call me, and I would be rude to her on the phone and try to get off the phone with her, and she would stay, and she would hang up, and she'd come back a week later and call me and do it again. So throughout all the bad stuff that I did, my mom was still right there. So as a kid, all the way to 36 years old now, anytime it got real and I needed support, if my mom couldn't help me, my mom's mom, my grandma, or one of my mom's brothers, or my mom's sister, it was just, my family is a huge reason, the biggest reason that I am the way I am, and that I've made it this far in the way things are. So just, you want to be there to support your child, grandchild, niece, nephew. That's all you can do, and sometimes that's a shoulder to cry on, and sometimes that's an ear to be vented to, and sometimes that's just not talking about it at all. Just pretending, not so much pretending, but just knowing it's there, but not having to dwell on it. You know what I'm saying?
Right.
And so that's the only advice I could give, really.
Right. That's some great advice. Most definitely, man. When was the last time you received a call from the transplant center? I know you're not on the list, but
about a year ago. About a year, or a little bit longer. This last year has been kind of rough. So they haven't contacted me recently, but about a little over a year ago, they contacted me and they asked me how I was doing, and asked me how things were going with my weight loss, and offered some encouragement on the whole getting back to where I need to be. And the positive thing about living in a rural town like I live, I have the opportunity to get listed out of state. So I actually have the opportunity to get listed at the hospital that I was listed to in Tucson, the U of A Medical Center. It's called Banner something Health now, but I have the opportunity to get listed back in Tucson, where I have all my family support. Well, where I have my mom and my sisters as family support. So when I get my transplant, I have that place to live for the time being as I'm there. You know what I mean? And
Right.
so that is a positive because then I also get the nephrologist that I absolutely love back as my doctor.
Hmm. Okay.
So that's a cool thing. But yeah, it's been it's been a little minute since I've heard from them, but they do pretty good at keeping in touch.
Right. So, so Jay, since you've been back on dialysis, have you seen anyone at your facility receive a transplant and then end up back at your clinic on dialysis?
I have not. I've seen quite a few people go for transplant, and thankfully, either they left Alamogordo and before they ended up back on dialysis, or they just never got put back on dialysis. So, thankfully, no, I have not seen anybody get a transplant and end up back. So that's a good thing.
Great, great, great. So we're about definitely coming down to to the wire, our time. But if anyone wanted to reach out to you who's watching this broadcast right now to just get more information from you, because you definitely been doing this a while. I know there's people who's been on dialysis 30, 25 years, but I mean, you started, you got your diagnosis at about 12 years old, went through that period, and now, I mean, you're definitely a warrior, man. I salute you for even coming on and sharing your story, because a lot of people who probably was who would have been in your situation would probably maybe still be hard on themselves, thinking back at that situation at 18 years old, and possibly not trying to revisit the transplant because of that, man. I definitely tip my hat off to you. And but if anyone wanted to reach out to you, how can they do that?
Ooh, that's a tough question. I mean, I have all the social medias, but knowing them offhand is tough. But on Facebook, if you just search for JAKE King, Jake King, they can find me on there. I'm on multiple uh, dialysis and transplant support groups. Like, I Hate Dialysis is one of them, and um, dialysis. There's a bunch of them that are on. I have a Instagram. It's under Jacob King or J King 3750, like not Jake, but the letter J, KING 3750. And then that's the same. I have a Snapchat too. That's the same, J King 3750.
Mm-hmm.
And I'm pretty active on them as it comes to looking at them. I don't post a lot, but I check them on a regular basis. So if anybody ever wanted to, questions or just to, like I said, just somebody to talk to about their situation, because you can be married, you can have kids, and you can or whatever and whatnot, and you could still feel alone on dialysis, just
Mm.
because no matter who loves you, no matter how much they love you, they're never going to fully understand what you're going through. And they can be the most caring, loving person in the world, and they can offer the most emotional support that they physically can, but there's always an added positivity to talking to somebody who goes through it on a daily basis just like you. And so, like I said, I'm always out there. I'm always out trying to. I don't, I had a bilateral hip replacement not too long ago, and I'm recovering from that. So I spend a lot of time on my phone checking these social medias and stuff. And I've even thought about starting a blog, a YouTube channel about dialysis, but all the Hippocratic oaths, or not oaths, but the HIPAA rules and stuff, it kind of makes it difficult. But I'm looking to kind of get into that area of just offering support, and that doesn't mean I get a transplant and all that stops. Like, one of my goals in life is to get a transplant, but the other one is, once I do, is to become a dialysis technician. And I know that sounds crazy to some people, but why would I want to go back to dialysis when I didn't have to? But that's just it. Spending 18, 20 years on dialysis, I offer a perspective as a tech that most techs can't give you. And so, go ahead.
No, let me. I'm sorry. Let me just interrupt you right quick, man. Dude, do that because I know someone who, I don't want to say his name, but he's on Facebook. He had a transplant. He's now a dialysis technician. And then I have someone that I work with who has lupus, and she knew that kidney problems were going to come. So before that, the kidney trouble started, she got into dialysis as a dialysis tech so she can know what to expect. Now she's on dialysis and she still work as a dialysis tech. So, bruh, you can do that, man. You could probably, once your hips get better, because of the standing and the walking, you could probably do that now, man. So please don't give up on that. Don't, and that YouTube, same thing, man, because it's people, you're in, New Mexico, but man, this disease affects everyone all over the world, overseas. And someone could just see what you're doing and it could give them some type of inspiration for that to double, to give someone else inspiration so we could kind of make known for transplant and kidney disease, man, because kidney disease is the ninth leading cause of death in the United States, but there's really no big push on it like it is breast cancer. And I just saw something on TV the other day, a big advertisement for fibromyalgia, not to discredit anyone who may be suffering from fibromyalgia, but you don't die from it. But you see,
I get you totally.
Yeah, you see more commercials for medication for that than you may see any type of promotion and prevention for hypertension or diabetes.
For real, I make that statement all the time, and when I talk to people who just have questions randomly, people don't realize there's been major stars in the entertainment industry that've had transplants, and you don't hear about it, like George Lopez and that Sarah Hyatt chick who played on Modern Family, and there's multiple others, and there's no push even by them to get out in the public, and I could be wrong, maybe where they live around them they do more things, but there's no national recognition of, you don't see commercials for the National Kidney Foundation like you do the National Cancer Foundation. And I've lost family members to cancer, and it's horrible, and it needs to be out in the open, but I don't feel like kidney function or kidney failure is out there enough when it comes to advertisement and billboards and just being in the public eye. I have one of my good friends that I met in dialysis. He's in his, I won't say his age because he might be watching, but he's an older gentleman, and he got his transplant because he was shopping for a car, and the car dealer that he happened to go to, his wife had wanted to donate a kidney, and the person she wanted to donate to fell through due to blood matching issues and everything. And he asked him, "Would you mind if I let you talk to my wife?" And my friend talked to this lady, and she matched him, or she went through all the testing, she matched him, and he got his kidney transplant like 3 or 4 years ago. And people like that actually go out and try to donate a kidney, people need to realize that you can live with just one kidney. So if you want to help the world out immensely, if 30 people went and donated one kidney, that's 30 people that are no longer on dialysis. And that's a small number compared to how many are on dialysis, but it's a start. And that's just, people need to realize that kidney donation while you're alive, most people think The only way I can donate an organ is when I die. And that's only true for certain organs. People need that. It needs to be put out in the public for all these giving people that want to help like that. That you donate a kidney and you're fine. You live your life completely normal after that.
Wow.
And as soon as that goes into the public eye more, it'll make a huge impact on the transplant. You know, they say, what do they say? Something like it's a large, like 200,000 people a year get put on dialysis, and you know close to that same amount of people pass away from dialysis. And if that can be cut into if a tenth of that could be taken away, you know what I'm saying? Like that's a great start. And it just kidney failure needs to be more in the public eye. I totally agree with that. Whether it's, like I said, advertising or even, you know, just the fact that you can now look on Facebook and find hundreds of pages about kidney failure, along with other unfortunate life-changing ailments. But yeah, I'm with you, brother. I mean, the fact that dialysis and kidney failure and the causes of it being hypertension. See, the cause of my kidney failure, they said, was urinary reflex. I didn't have high blood pressure. I don't have diabetes. I don't have some of the normal causes of dialysis. Of kidney failure. But that stuff needs to be out there because people think, oh, my blood pressure's high. It's not a big deal. I'll just deal with it. But it is. It's a huge deal, and it could change your life forever. And all you got to do is get tested and find out and then take care of it.
Absolutely. I agree. All right, Jake, we're definitely out of time. We ran over, man. I really appreciate you being on the show.
Yeah, no doubt.
You know, giving us this chance to interview you and give us your perspective on transplant and what you've been through with this. I really do hope you do start that blog, that YouTube blog, because I mean, we definitely need more people. I know there's a lot of kidney groups and groups in different parts of other social media, but we need more. We need more. You know, even people like yourself, like you mentioned, at one point you was non-compliant with some of your treatment regimen, and you had a talk with a therapist and with your doctor, and now you don't cut your time. You do what you need to do, and you're feeling good about it. And a lot of people need to hear that, because I know a lot of people who are on the opposite spectrum of that, and that's doing real bad. They want to know why they feeling bad or why this is happening, and not realizing that they hold the key to a lot of those symptoms that they're having.
Yes, sir.
Absolutely. So, man, thank you for coming on. I know I'll be seeing you and talking with you through social media. My phone is always open if you want to reach out and chat. But I really appreciate you being on the show, man, and look forward to seeing more things coming from you.
Yes, sir. And when I get that YouTube, I'm gonna hit you up to help me find some followers, right?
Oh, absolutely, man. Please, man. Whatever help you need or whatever you're trying to do to promote, kidney disease awareness, transplantation, or anything in that realm that deals with kidney disease, please reach out to us. And there's other guys on here that are willing to help you out. One guy, Joe Bueno, who has Transplant 24/7. He's a transplant coach down in South Carolina. So, man, please reach out if you need some help, and whenever you're ready to do this, man, we'll be here for you. And I'm real about that.
All right, for real. That sounds good, man. I appreciate that.
All right, man. All right, Jake, take care. We're going to end the broadcast. Again, I'd like to thank Jake for being with us today. Everyone, thanks for watching Sunday Morning Transplant Coffee Talk. We'll be back next week with another guest. Take care. God bless. Take care, Jake. See you soon, brother.
All right, man. Take it easy.
You too.